Yes, please come in. Hi, Valerie. How are you? How can I help you? Oh. Well, this is a COVID PCR test result in a clinic somewhere, and it is negative. It's been done the day before. So, what happened to you? Do you have any nose block? Any bleeding? Yes. Is it both sides or only the one side? Is it left? Oh, that is left. Okay. Well. But looking at you, I need to examine, see what's going on in your nose. Come, please. Come to the side, the examination chair. Well, it's safe to take down your face mask now. Let me have a look inside. Okay. Well, this is over the left nostril. Any pain, you let me know, okay? Let me look at the right side. Alright. Well, I can see there is some wound over the left side of your nose, over the septum. But there is no active bleeding at the moment. There is some crusting there. Had you done the swab test over the left side of your nose? Okay, never mind. There is some injury there, but don't worry. This bleeding is already stopped. Okay, it's already stopped. There's no active bleed at the moment. No need to do anything basically. Let me give you some medicine, okay? Please come. Yeah, you can wear your mask now. Alright, so basically, right, alright, take care. Remember, don't pick your nose, okay? Okay, guys, you can see, right, just now the patient who came in with a complaint of the nose block and bleeding. I believe a lot of people underwent this kind of nasal swab, say for the COVID test, with an unpleasant experience. Why? Here actually I want to explain to you. You can see this is our lateral wall, our side wall of the nose. There is one problem when people doing the swab test. I notice a lot of people when do swab test, right, they tend to extend their neck up, you know. So you see, this is a swab that I prepared. You can have a look. When people extend the neck up like that, so the swab, you go hit the roof of your nose, you know. The roof here is actually the skull base already. Even though it's very unlikely to penetrate the skull base, but it is very uncomfortable. It can cause a lot of tearing, bleeding, and pain. That's why a lot of people initially they have some unpleasant experience when they do the swab. So this is what I need to tell you guys. If you need a swab test to be done, you have to put your neck in this normal neutral position rather than extend your neck or not your head down, okay? So when doing the swab, people should follow the floor all the way to the back. We are taking a nasal swab over this nasal pharynx where the mucus collection is the most here. When they reach here, then they can twist to get some sample, then they will pull out. So you can see this is follow the floor. Means when you do the swab, it's like that, going deep inside, rather than you go up like that when the patient extends. Let me demo to you. See, when you do the swab test, you go in, you follow the floor, go all the way to the back. Yep, you reach the back already. You twist, then you pull out. It's done. You see, no tearings, no pain. If doing in the correct way, shouldn't cause any pain. Alright, maybe the most discomfort. Alright, it shouldn't cause bleeding as well. This is commonly seen, especially those pediatric age group, you see, the kids, because they move a lot, right? That's why we have to be careful when we do the swab test as well. So just remember, don't extend the neck, okay? This is the proper position that we do, okay? Come, let me tell you something about what's going on to our nose, you know. So when we do the swab test, right, we have to inform to the person who did the swab. whether you have any nose issue, for example like allergic rhinitis. Because when they do the swab, you may sneeze. This can be quite dangerous, right? When they do the swab, then you sneeze, you may spread all the aerosol, isn't it? Another thing is when you have any structural deformities over your nose. For example, the most common one is the deviated nasal septum. When there's a deviated nasal septum, it narrows down the nasal space on the right side, either right or left side. So when they do the swab, it can be very painful, alright? Another thing is like when you have any nasal surgery done before or recently, you have to tell the person. This surgery including the nasal surgery or any skull-based surgery, because when there's a skull-based surgery, when they do the swab, they can be accidentally go up here. Do you know what is up here? This is our brain, okay? So even though very unlikely to injure that part, but at least we inform, people may alert, they may know how to take care about it. Another thing is the trauma. Okay, any head injury or skull-based injury, you may have some fracture over here. So when they do the swab test, if they're pointing upwards, that can be a disaster, alright? It can cause CSF leak or some problem over here. Well, hope my explanation and my teaching to you and demo to you how I did the test will help people to understand more about how a test being done, so that they can take care of themselves. Alright, hope these videos will help. Take care and stay safe.